Dr. Pillay, IT Lead, North Lincolnshire CCG. Now, in this video, we're going to learn about the high-risk COVID-19 patient searches and also how we do a mail-merge shielded advice document for these patients. Let's talk about the searches to begin with. There's a lot of controversy about this, and what we know is that the searches may not have reached your EMIS organization as yet. So how do I know whether the search is there? Well, in actual fact, you go into the EMIS bubble, you get into reporting, go into population reporting, and apparently it should be under EMIS. So if you click the EMIS library there, you should find it under EMIS Clinical Utilities. There should be a COVID-19 search directory. Now it's quite clearly not here in ours. So all you would then do is you would go to the main screen. When you click on the EMIS Web COVID resources, it'll bring you to a website with COVID related tools on. Quite useful if you've not tried it just yet. And if you click on the searches, it'll tell you exactly where the search is. And obviously if the search is not there, what you can do to download it onto your organization, which is exactly what we've done in my practice. So coming back to the search bubble, reporting, population reporting. On my practice organization, we have got a COVID-19 directory, and this is what the search actually looks like. Now, let's keep this in mind. These are codes done from central extraction data, from secondary care, and as of last week from primary care as well. And it's telling me for my patient population, it's identified about 302 patients who are at high risk. Now, what's the ask of us? The ask of us as GPs is to go through that list and make sure that these patients are actually high risk, and then to give them shielded information if they have not already received shielded information, which once again is a bit controversial because some of my patients have received letters centrally and some haven't. Okay, so how then do we make our lives a bit easier with regards to giving these patients shielded information? Luckily for us, we have got Primary Care IT that's given us a protocol to make things a bit easier. So if you have a look at your organization notepad, you will find a little message. And I'm just going to talk you through how we get that added onto our shortcut menu. Follow the instructions. Press F12. Okay, so from here, I'm going to right click which alphabet I want to use as my shortcut key. I'm going to right click that and press Add. I'm going to go into Riverside Surgery, or whichever GP practice you belong to. Find the Primary Care IT subdirectory. Open it up over there. Open up the COVID directory, and there we go. Coronavirus COVID-19 high risk shielding administration shortcut, and we can see that that's there. Okay, so let's just say you're now dealing with a patient who phones up the practice. You've had a look through his patient summary and you think that, well, actually this patient has got lung cancer, but centrally he's not been identified as having high risk. So at this stage, all you would do is you would go into the patient record. Just ignore all of that. And at this stage, all I'm going to do is I'm going to press F12. It brings up my protocol launcher. You can see that I've got the high risk shielding admin shortcut. I'm going to double click that. It's going to say, what do I want to do? Do I want to code this patient as being high risk? And the answer is, well, yes, it's just been diagnosed with lung cancer last week. I'm going to click that. Okay. Do you want to print a shielding letter now? And I'm going to say, yes, thank you very much. Okay, and at this stage, we've got a shielding letter, which I'm just going to press save and close. It auto-populates it with your surgery name. And I'm going to press save there. And before we do that, let me just draw your attention. It has automatically put down COVID-19 high-risk patient there for you. So let's save that. Let's go into care history and let's just see whether a code has been applied. That is the code that currently comes from Public Health England, risk of exposure to communicable disease, and that's been coded for us quite nicely. And let's have a look at the document. We've got a COVID-19 document over there. And it's quite clear what we can do with this document. It's basically the shielded information advice that's come centrally, and at this stage we can either print the document out, give it to the patient, or we can email it to the patient, or we can use AccuRx and send it as an attachment to the patient's mobile device. Now, EMIS will be updating its organization with medium risk and low risk patients later on this week, and when we get that information, we will be giving you further information with regards to how to go about coding those patients. Right, so next steps. If the patients are correctly identified, no further action. You might just want to check if they've got shielded information. If the patients have been wrongly identified, then keep their names aside, and there will be codes released later on in the week for you to exclude them from this list. And for patients that have not been identified, then please by all means use the F12 protocol that we've just shown you how to use on this video.